community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to the show. We are Bobo 103.1 FM, and every single weekday, we give you a very special show from HSA where we discuss what really matters from the organization. Could be a special event that may be coming up. Maybe there's a specialty that we need to discuss, and that's exactly what we're going to be digging into today. Or maybe there's an area in the HSA that's just been established, and we want to get the information out to the consumers first. This is the best outlet. There's a lot of listeners to the show, a lot of medical students. Big up to all the medical students that are also listening. We always love to have your questions. Go ahead and send us a message on our Instagram or Facebook at Bobo 103.1 FM. All right, so I have the privilege of interviewing somebody very special. It's the first time I've actually interviewed this individual and this department. First time for me, perhaps not for the other colleagues of mine, but I'm going to have them introduce themselves first. We usually do that as a standard here, and their occupation and what they do in the area of HSA. Go ahead.
Thank you so much, Jane. Thanks for having me. I'm super psyched to be talking to you and the listeners today. So my name is Dr. Sahebaan Sethi. I am an ophthalmologist and eye surgeon at HSA. I've been associated with HSA for close to a year now, but in practice for over 15 years overall. I'm an anterior segment surgeon, so anything to do with the anterior part of the eye, I take care of, and I specialize in cataract and glaucoma. And I'm a UK board certified ophthalmologist here at HSA, willing to help everyone here on the island.
I love it. How long you been there again?
Close to a year.
A year.
Yes.
Yeah, but you've been in the field for how long?
For 15 years.
15 years.
Yeah.
You're still pretty young.
Well,
Did I get to say that? Because you did. How long did you stay in medical school for?
Well, not all that glitters is gold, so I am
glittering.
not that young. I pretend to look young.
You
but
pretend
then
to
I'm
look
not
young?
that young, yes.
How long did you spend in medical school?
Well, we do a round of about 12 years overall,
wow,
which
yeah.
includes undergraduation for 5.5. Then there's post-graduation for another 3 years, and then super specialization, which is you pick a certain area of the eye and then you super specialize in it. That's close to about 2 years or so.
Should we be interviewing you on the whole eye clinic service, or should we be talking about how do you stay young? I think that should be the interview, right?
Well, how I stay young is a question for my salon
Okay.
provider.
Yeah, okay.
I will stick to the medical questions.
Yeah, so the medical question is what you're here for. Thank you so much for joining us. It's definitely a privilege to have you on here. And we can't wait for you to kind of break down your services that you offer at HSA, but also your knowledge, because you come with a lot of that. You've been in school for a long time. You've earned it. And we can't wait to know everything. I always say to people that every time we have a doctor come here, we've always learned something more intriguing every day, or every Friday we do these interviews, and we find out just more and more that we did not know about HSA. So it's always so good to have you guys on. The first question I kind of want to start with is just all the services that the eye clinic offers. What are all the services you guys offer?
So, I'm very proud to share that HSA, I think, today stands at being a world-class facility in providing all sorts of eye care services. We have state-of-the-art OR. The operation theaters are amazing. We've recently acquired some really top-notch equipment as well. And we have great surgeons with great skills. We've been doing a great job for the past close to 1 year that I've been around here.
Yeah.
And I've heard great things even in the past. So as far as the services are concerned, we cover everything from the front of the eye to the back of the eye. So let's say everything to do with glaucoma, everything to do with cataract, everything to do with the diabetic conditions in the eye. Now, these three things are extremely prevalent on the island and are the focus majorly for about, let's say, close to 60% of our patients.
Yeah.
Over and above that, we also offer corneal services. We do pterygium surgeries. We do pediatric eye care. We have a pediatric specialist on board, Dr. Aditya. He's my colleague. He also specializes in squint surgery, so any deviation of the eye. We prescribe glasses. We do, complex cataract surgeries, even patients with injuries, maybe with an open globe and things like that. We can repair all of that. So everything from the front of the eye to the back of the eye, we cover medical and surgically.
I love that. You mentioned a word that stands out, glaucoma, correct? What is that?
Right. So glaucoma basically is a serious condition. Now let's just say it's a disease of the optic nerves of the eye. Now, an optic nerve is a nerve that connects the eye to the brain. So think of it as a wire that takes information from the eye and gives it to the brain, and only then can the brain interpret and you be able to see.
Yeah.
So once that wire is weakened or loses its cells, that's when the vision starts going down. So it's the disease of the optic nerve, and it causes irreversible vision loss. So that is what makes it stand out and makes it a dangerous condition, because any vision that's lost from the loss of cells in the optic nerve are permanent. So the patients start with having loss of peripheral vision, right? Like when I say peripheral vision, to the far extremes of their vision is when the vision starts getting blocked, and slowly it starts encroaching towards the center vision. And another thing that makes it a little unique is that it is asymptomatic in close to 80% of patients. So patients don't have any signs or symptoms to actually know that there is a dangerous condition like this that is growing in their eye. And by the time they find out, the vision from the periphery has already reached the center, and it started affecting their quality of life and their vision severely.
Oh, wow.
Which is probably the severe or the last stage of glaucoma that patients usually, themselves present for, and is a little more difficult to manage.
You know what's scary? Because you just said it, because that's leading me to my next question, right? You said that there's no symptoms. Is that what you said?
Right.
So my next question was actually signs. So there's no way that an individual, perhaps somebody may be listening to this now, and they're obsessed with their health, right? There's a lot of people that are taking more focus to their health now, and they're saying, well, how do I pick up on this then? There must be a way that I can tell if I can get this, so I don't have to deal with what the results can be for me later on, right? So is there any signs at all?
Sure, of course there are. Patients can. I think being mindful doesn't hurt, and there are so many patients that present to the OPD with, being a little more mindful of their eye health and overall health than other patients who we are able to pick up glaucoma and other, subtle conditions much more better. So now signs in glaucoma, very subtle signs could be frequent change of glasses.
Yeah.
Right? Now, if you feel that you've changed your prescription and every 6 months or every 8 months or so, my number keeps changing.
Yeah.
That could be an early sign of glaucoma. Right? Now, when you also present to your optometrist, you can go for regular eye checkups, and they say that your eye pressure is high. That can also be a sign of glaucoma for you to come and see an ophthalmologist following that. I think beyond that, also subtle headaches, subtle eye pains, heaviness around the eye. Again, there are two types of glaucomas, right? So symptoms can differ according to the type of glaucoma. You have an open type, and then you have the closed angle type. Now, an open angle glaucoma basically means, when I say angle, I mean the drainage system of the eye. So let's just understand what the problem in glaucoma is, right? So in about 60 to 80% of patients, it's a raised eye pressure that causes pressure on the optic nerve and starts damaging the optic nerve gradually.
And where can that pressure come from? Where is that pressure?
Right.
Yeah.
So the eye creates its own fluid and drains out its own fluid. So
Okay.
there's a good harmony that happens with the amount that's created and the amount that's drained in a regular normal eye, which is healthy.
Yeah.
But in an eye which is affected from glaucoma, the drainage system is faulty, right? So like I mentioned, there are two types, open and closed angle. Now, in an open angle glaucoma, the drainage system may be open, as in the fluid reaches the drainage system, but the drainage system is intrinsically non-functional. So it doesn't drain through,
Yeah.
right? So there's a buildup of that fluid in the eye, which raises the eye pressure. And because of constantly being high, it causes damage to the nerves. Now, conversely, there is the closed angle glaucoma, which basically means that the drainage system intrinsically may be functional, but the access of the fluid to the drainage system is blocked. So now the closed angle glaucoma is a medical emergency, right? Now patients do have very evident symptoms if they have an acute angle closure attack. Now it can be severe eye pain, severe redness, there will be blurring of vision, there will be clouding of the cornea, which will make them see halos and rainbow around light sources. They will have severe headache, nausea, vomiting. So that becomes a medical emergency and you can't really miss it, right? So you present to the ER with these symptoms. Now that's an extreme case, but then an open angle glaucoma is asymptomatic in 80% of cases. So in these, I think in this category of patients, which is very, very high in this island, I think one should just follow up with regular checkups once a year. You can easily go to your primary eye care provider if you're finding it difficult to meet a doctor right away just for screening, which may usually become a problem on the island because we're just inundated with so many patients with more serious conditions, right? So sometimes doing routine examination gets a little difficult for us. So you can always go to your primary care provider and get your eye pressure checked. They even have very sophisticated instruments. In fact, I'm very happy to share that a lot of optometrists and primary eye care providers, which are optical shops, they have sophisticated equipment to even visualize the back of the eye.
Okay.
So they can take scans, they can look at the back of the eye, and if there's any suspicion, of course, and that is when a referral goes to an ophthalmologist for your further comprehensive checkup and plan of management. So, so I mean, I would say if you're above 40, go for regular eye checkups, right? If there's any suspicion, you will be routed to an eye doctor any which way. Don't wait till you start feeling that there's something wrong with my eye, because like I said, in glaucoma, the vision loss is permanent. So it's an irreversible loss. So don't wait for your vision to get lost, because then we cannot really benefit you much with even treatment.
Yeah, that's such a sad thing to tell somebody too, that your vision is gone.
Absolutely.
I don't know how you guys would.
So many patients who, they're blind with both eyes. Some of them have been lucky enough to just, be blind in one eye, and the other one we're able to manage. But all of these situations, the prognosis is quite bad.
Yeah,
right? And you see them coming into you every 3 months, 4 months, and it really pains to, sort of tell them every time that, it looks all right, but what does all right mean?
Yeah.
Right? You've already lost your vision. So that's a very difficult situation for me as a glaucoma specialist to, turn down patients and say nothing can be done. And sadly, we don't have any research, we don't have any surgeries, medical science, any stem cell injections which have been successful in human eyes that can regenerate a dead optic nerve. So hence, I think that's why doing shows like these and creating awareness amongst population is paramount. Because, with glaucoma, the only way to make sure that you don't lose vision from glaucoma is regular checkups and early detection. And if detected early, we can very well manage it.
And this is a progressive disease, correct? Since you just answered yes to that, what are the stages?
Okay, so now glaucoma is something that once detected, a person has to live with, right? Now, we cannot get you rid of glaucoma. It's something like diabetes or hypertension.
Yeah.
Once you're detected, you just have to sort of maintain it all your life, and you cannot really treat it and get rid of that condition. So something similar with glaucoma. It's a genetic disease, and when you were born, your genes have decided that you're going to have glaucoma at some point or the other. So it's just a matter of time when it manifests.
Yeah.
So, and when it does, I think it's basically it is progressive, and we attempt to diagnose it early. Now, if it is diagnosed early, yes, there is a very, very good chance that we can halt or slow down the progression of glaucoma to make sure that there is no significant loss of vision, significant, even compromise of your quality of life. So that guarantee I can take as a glaucoma specialist.
You know, there is hope in that area. But what I would like to say, in your 15 years of studying this or being a doctor in this area, in a specialty, have you had success stories like that, where somebody caught it early and you were able to help them with their vision?
Oh, yes, absolutely. Absolutely. Yeah. And I think the most mindful of such patients are people who've already had it in their family.
Yeah.
Right? Now, those are the most anxious patients because they've seen their, let's say, grandfathers or their mothers or fathers suffer from blindness and, be limited to their 4x4, walls.
Yeah.
Not being able to spend the, kind of life that everyone wants to. So they've grown up seeing that. In fact, I had back home, I had a young girl who was 15 years old, and she was so terrified because, and she would make sure that she would tell her mother that I need to go and get my eyes checked because I don't want to be like grandfather because he lost his vision. And we're also probably talking about many decades ago when, medical science was not that advanced.
Yeah.
People were not that aware of their conditions, medical services probably were not that accessible. So this little girl had been traumatized by seeing her grandfather from the age of 50, being completely dependent on family members, staying inside his home and living a life which, seemed hopeless to the girl.
Yeah.
So she was, someone that of course, like, till the time that I could follow her up, she didn't really have anything. But just the fact that, talking to her made me, it just makes you feel in touch with your human side, where you feel that as a doctor, it's not just your job to prescribe medicines, but also understand what the patient is going through and maybe just, counsel or hear them out. As simple as hear them out and reassure them and settle them down. But of course, so yes, if you say, there are success stories, there are many. There are many, many success stories. But then there are many, many heart-wrenching stories as well.
Yeah, I can imagine. And we're going to hear about them very soon. We're going to take a quick commercial break in just a few. But as you were having this discussion, it was a little bit scary to hear about it because I'll be honest with you, I was sitting here while you were talking and said, Matt, which one could I pick between? Like if I heard that you can either choose, Dane, losing your hearing or your eyesight. And I think I would go with the hearing. I can't do without eyesight.
Yeah.
Like I feel like I need to see the world.
Oh, that's really interesting. So I'll tell you what. So there was the American Association had a survey. This was, I think, a few years ago. And so they just generally asked patients in the whole of America about what they were most scared of, which health condition they were most scared of. So only second to heart attack came blindness.
Wow.
Yes. So
Wow.
forget about all other problems in your body.
Yeah.
You are either afraid of death, number one,
Yep.
or number two is blindness.
Yeah.
Yes.
Yeah, I can't. Like
Yeah.
it always fascinates me with just things that we have yet to see around the world.
Absolutely.
And the feelings that you get too. Like if you travel with a loved one and you see how much their life is brightened up by you surprising them with something, you don't want to miss that moment. Somebody explaining it to you is just not the same. Doesn't feel the same.
Absolutely true.
Yeah.
And that just increases, like you saying that, and the smile on your face itself is just making
Yeah.
you feel that there's so much responsibility on us.
It is.
There's so much
It is.
responsibility as eye surgeons, and we're trying our best. And I think we've done a great job. HSA has been doing a great job in preserving people's eyes, and we're helping out a lot of people. So I'm happy and proud of that.
When we come back, we're going to hear from the good doctor on what drove her into this field. I want to know if this was something that she experienced in her life that said, this is a specialty I want to take on and I want to change people's lives. It's just fascinating, the things that you were discussing, but you never really think about your eyesight until it's brought up in a conversation and just how important it is. So Thank you so much. We're going to come back after a commercial break, a very short one.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
All right, welcome back to the show. It's Bobo 103.1 FM. It's Dane hanging out with you. Thank you so much for being a part of the show. Don't forget, your ways that you can message us is simple. Go on our Instagram, go on our Facebook. The message icon is right there at Bobo 103.1 FM. Send us any questions you have. We'll make sure it goes over to the good doctor. We're going to have her introduce herself once again and her specialty.
Right. Thank you, Dane. I'm Dr. Sahebaan Sethi. I'm an ophthalmologist at HSA, a UK board certified specialist in cataract and glaucoma.
Oh, amazing. Is it UK based, so not trained in the US?
So I have degrees from the UK. I've been practicing in India though.
Okay.
Yeah.
All right. Is there a difference between obviously?
So, well, there are various levels,
Yeah.
right? So you go through your undergraduation, you go through your post-graduation, and then super specialization. Now, then there are various qualifying degrees that you can, attempt to write exams for, which enables you to get into the board of that particular country. So you have the USMLE for America, for US, and you have FRCS for the GMC registration, which is the UK board. And FICO is what I have that enables me to be on the UK board certified level.
Yeah, you're definitely certified too. We've heard about your process going into school, how long it has taken, and we know that you are more than qualified to be answering these questions today. Now, a very important one, Doctor. I know a lot of people missed out a lot of the questions today, but they can recap it again when we play the show over. But I do want to ask, how often should we be getting our eyes checked?
So, honestly, for adults, I think once in 2 years is a good enough gap for people who are healthy and otherwise don't have any problems, whether systemic or in the eyes. Once in 2 years is a good time. For kids, I would say once a year.
Okay.
And it can start as early as childbirth. Now, if there is a premature childbirth, the child should be checked for retinopathy of prematurity, which basically is that when you're out of the womb before your intended time in the womb, the retina, which is the back of the eye, may not be fully developed, right? So in those cases, in premature babies, we check their eyes right after birth. But I think for healthy children, once before they enter school, which is at 4 years of age, should be the starting point of their eye checkups and should go on annually until they are 18 years of age. Thereafter, it can be once in 2 years, provided they have no other problems. If they wear glasses, if they have a prescription, then it continues being 1 year. But I would suggest for patients who are above the age of 60, they should have annual checkups.
Okay, amazing. Now, for me, I'm going to ask this question because it's very important. When I was younger, I got an eye checkup at least once a year. I think it stopped at 10. Like, that was it. I don't remember going back in.
10.
It stopped at when I was 10. Or 15, I went back in for just a one-time check, just to be sure, because I was having some headaches at the time.
Yeah.
Nothing that was affecting my eyes, but my mom still wanted to get checked out from my eye perspective, right?
Yeah.
I've always been told I have 20/20 vision,
Okay.
even at 15. And the reason that was important for me to get checked up during that period too was because I had dreams of being in aviation, and you know, and I did take it that far too. But obviously, music captured my heart. Yeah. For someone like me, right now, should I still be considering going and get checked up? Because obviously, I'm no longer 15 or 16 anymore.
Absolutely.
Okay.
And see, now a 20/20 vision doesn't necessarily mean a healthy eye.
Okay.
Okay.
Talk
Your
about that.
eye can still be diseased and you still be able to see 20/20 initially. Now, we're on the topic of glaucoma, so let's just take glaucoma as an example.
Yeah.
Right? Now, glaucoma is a condition which starts affecting your peripheral vision first, which means that when I'm looking at you straight, straight ahead, I am still aware of what's kept on my extreme left, extreme right, right now. So I have a 30-degree of field of vision around my center that I'm aware of. right? So this is what makes things like driving easy. It
Yeah.
makes things like you're walking straight, but you still know where huddles are on the floor, on the ground when you're walking. So that's your awareness around, even if you're not looking directly at that particular direction. So this is your peripheral vision. Now that can start getting affected, but your central vision on testing can still be 20/20.
Yeah.
But then that doesn't mean that you wait till the last stage, wherein you can still be 20/20 and have an advanced stage of glaucoma to actually come and see an eye doctor. And that's why I mentioned earlier, a good vision, a good healthy 20/20 at your primary eye care doesn't stop there. You have to have a comprehensive checkup every 2 years, which means looking at the back of the eye as well, looking at the retina, looking at the nerves of the eye, even diabetes, for example. Now, we're talking about two very important conditions which are extremely prevalent here on the island, diabetes as well as glaucoma. Now, even in diabetes, you may have 20/20 vision, but your retina may be affected with diabetes, and that if left untreated, it just, it spirals.
Yeah. Yeah.
And then it just gets more and more difficult to control it in the future. So if you have any systemic disease, now I can actually, push aside like a group of patients who are probably at a higher risk of developing glaucoma. Now, those patients are patients above the age of 40. Now, those patients should necessarily get an eye checkup once a year, I
Yeah.
would say. Okay. Now, anybody who also has any other systemic conditions like, let's say, diabetes, hypertension, now those patients are also at a higher risk of developing glaucoma as well as diabetic or hypertensive retinopathy, which is a problem with the back of the eye that can get serious in the future if left untreated. Now, also the ethnicity. Right now, the black population is known to have a very high incidence of open angle glaucomas.
Yeah.
Conversely, the Asian eyes are said to have a higher chance of closed angle glaucomas, which are the more dangerous ones. Also, if you have thick glasses, let's say if you have a high minus number, high myopia, or a high plus number, high hypermetropia. Now, these eyes are also more predisposed to developing glaucoma.
Yeah.
If you've had a family member who has glaucoma, it's a no-brainer for you to have to go to an eye checkup every once a year. Now, if your siblings have had glaucoma, you have a 20% higher chance than an average person without any history of glaucoma to have the disease. And if your parents have had glaucoma, you get a 10% higher risk.
Oh,
right?
wow.
Also, I think if patients are on steroids for any problems, let's say systemic steroids or even topical steroids, eye drops of any kinds, if you've had injuries around the eye or in the eye, now these are a group of patients who should be extremely vigilant about their eye health and go for annual checkups.
Yeah.
I think for the rest of them, adults, if they're healthy, they've gone to their primary care provider, which is an optometrist. They will generally check their vision, their eye pressure. They do a great job, right? Like we get referrals all the time about even little suspicions they have. So they're extremely careful,
Yeah.
right, to not do any harm,
Yeah.
which I really like. And they're very well trained, so you can always go to your primary eye care provider, an optometrist, get your vision, get your eye pressure checked, get a look done at the back of the eye, check the retina, check the optic nerves. If there is any suspicion, you will be routed to an ophthalmologist. But then if you're healthy, if you have glasses, you pick up your glasses, you wear contacts, you get your contacts. But at any point you feel that your glasses are not able to give you a 20/20 vision, that's again another indication you need to go to an ophthalmologist to find out what may be the cause of low vision. Sometimes it's as simple as cataract.
Yeah. It's so scary because here I am sitting down, even doing this interview with you. I'm like, well, you know what? I'm going to be educated on it, but I never have to worry about this because this wouldn't affect me. Sitting here thinking I got 20% for 20/20 vision for life.
Yeah.
For life. And somebody's probably sitting in the car saying the same thing. But I'm okay.
We always never think that, it could happen to us
Until it does.
Until it does, right?
Yeah.
Now, sadly, I lost my dad to COVID, right? So when COVID was
So sorry
on
about
the
that.
high, thank you. When the COVID was on the high, we were all, okay, it's not going to happen to us. We were medical professionals. We were going out there. We were working. We were helping COVID patients, all of that. But then it's only when it happened to you, someone close to you, that's when you realize that these things are real. And,
Yeah.
you should really take it seriously again. But having said that, I don't want to impart the message that this is something to be terrified of. So please don't take back this message. But yes, a regular eye checkup can really go a long way in detecting glaucoma. And at the end of the day, if you're predisposed to it, nothing can stop you from having it.
Yeah.
Right? So this is not a preventable disease. If you have to have it, you will have it.
Yeah.
But if diagnosed early, it's my guarantee that we can make you survive with a good functional vision for the rest of your life and live like a normal person.
Yeah. It's good to know, too. It shouldn't scare you. I'm glad that you brought that up, that a lot of people would listen to this and be like, oh, my goodness, like this runs in my family,
Yes.
or maybe this is something that can happen to me. I'm a lot like Dane. I thought that because I had 20/20 vision when I was 15,
Yeah.
that I never have to go to the eye doctor again. But that's why we do these interviews, to educate you. So I think the only thing you should be thinking is not that you're scared, but when can you book an appointment? And we're going to tell you about that very soon throughout the interview on where you can go to make that booking. Now you find out you have a patient. They came to you to get a checkup, a regular checkup, and you have to unfortunately break the news that they perhaps have this disease. Is there a checkup schedule that person should follow moving forward?
Yes. Yes. So we do have something called visual fields. That's an investigation that helps us stage glaucoma, right? So now glaucoma can be mild, moderate, or severe. Now, for patients who have a mild glaucoma, we usually are able to treat them with eye drops. Now, the purpose of these eye drops is to lower the eye pressure and release the pressure on the nerves, which is causing the cells to die. So, in those patients, if we're able to control the eye pressure toward the desired level, to the target level, we ask them to follow up once a year. And this is only provided the doctor's given you a green signal that your eyes are well controlled with the medications you're on, and the fact that they're compliant with their medications. So the rate of non-compliance is as high as 50%. Now, let's just face it, it's a real issue. So it's not just as simple as you coming to a doctor and getting a prescription. It's also important you go home and apply it, right? Now, medicines will only work if you use them. So compliance is a big issue as well. Now, as long as you're compliant and your doctor says these drops are good enough for you, once a year is a fair gap to have before your next follow-up. But for patients with moderate glaucoma, we generally do tend to, deviate a little towards higher number of medications, maybe medications not working, so switching to laser. A lot of times, surgery may be required at that point. And in those patients, because there's so much happening, once in 6 months is what is recommended for follow-up. Now, with severe cases, now when I say severe cases, you almost just have tunnel vision. Okay, now tunnel vision means a significant part of your peripheral vision has already been blocked out. And it's only in the center part of your vision that you're able to see. Now, for those patients, coming back every 3 to 4 months, even if they are well controlled with the medications or surgeries, whatever they've been treated with, is a must.
Sounds good, man. There's definitely a lot of information here, and I've noted the listening public is finding it just as intriguing as I am. One thing I do want to ask, though, we've heard of obviously protecting our skin when we go out into the sun. We live in a tropical climate, but protecting our eyes often, a lot of times, is neglected, right? A lot of people do not take that as serious as they should. Let's give you an example. If somebody's hearing that there's going to be a very special occasion today when it comes to the sun, it's going to do a rare eclipse form or something is going to happen. We tend to forget about the procedures in looking at the eclipse. Sometimes we get so excited, we run outside, we just want to look at it. Or if we're just out on a day on the beach or just hanging out with the family, we tend to sometimes look up at the sun. How harmful is that?
Well, we belong to a tropical climate, right? Now, in a tropical climate, we don't really have a choice because there is no off time. Now, we have an overhead sun throughout the year. And also being geographically closer to the equator makes sure that the sun is more overhead and more direct to us. So the layers of the atmosphere which could filter out the harmful UV radiation are fewer. So more harmful rays reach us. Now, with the eye, UV rays certainly are harmful, but we also have a protective lens inside of the eye, which cuts out a bit of the UV radiation naturally. So, now this is the lens that goes on to have cataract as we age. And then once the cataract is removed, the natural protection of the UV radiation with that natural lens is taken away. And we, put the transparent artificial lenses in place of that. So I think wearing polarized sunglasses is extremely important. It's very, very critical for an environment and a weather like ours. So whenever you're outdoors, wear your protective glasses. Whenever you're, it can cause dry eyes. Now UV radiation can cause dry eyes. It can even cause phototoxicity, which is basically just unexplained low vision.
Yeah.
It may not be severely low, but it may just be borderline low, but you just can't explain it. Now that happens very often with patients who are out in the sun a lot. Now pterygium, for example. Now pterygium is just a red fleshy growth on your black portion of the eye, which is the cornea. That's also very, very common with patients who are exposed to UV rays a lot. So wear your protective glasses, and also when you're going out in the water, let's say ocean, or you're swimming, wearing your goggles is extremely important, because
Yeah.
that also is a point of contamination. That's a area where there's high chlorine, there's high salt content, there's germs of all kinds. So you have to be very, very careful even there. So any sort of protective gear is extremely important. And also with occupational hazards, let's say screens all the time,
Yeah.
right? Now that's another occupational hazard as well. So
That's me.
and including us, I can't blame anyone. It's a part of our job
Yeah.
as well. So
Yeah.
we're in front of the screen all the time, and it's close to at least about 6 to 8 hours in the day.
How do we protect ourselves from that, though?
Right. So now excessive exposure to screen can lead to something called computer vision syndrome. Now, what the computer vision syndrome means is that you will start facing, let's say, patchy times in the day where you have blurred vision. Okay, you may feel that your eyes are extremely gritty and dry and they burn all the time. You may feel a slight heaviness in the eye towards the evening.
Yeah.
That's towards the end of the day when you've done so much of screen work. Slight headaches, constant headaches that you can't explain otherwise.
Oh, man.
So this is like a triad of what comprises of the computer vision syndrome. Now, there is a way to break that cycle. I think a very, very good way of doing it, and a simple way of doing it, is remembering the 20-20-20 rule.
Yeah.
Now, which means that every 20 minutes, throughout your screen exposure, the time of screen exposure, every 20 minutes, take a break of 10-20 seconds and look at something 20 feet away.
Okay.
So that's the 20-20-20 rule. So now what this does is, because your eye muscles are constantly in a spasmodic state of looking at one particular screen and that one particular distance and direction all the time, it just, that spasm causes eye aches and pains and even, development of glasses.
Yeah.
Now for adults, now let's say, you've never had glasses in your life, and at the age of 25, 35, you go and the optometrist or your ophthalmologist tells you that you have glasses, and
Yeah.
you don't really understand why or what made them have that. So a lot of screen exposure can also induce a glass number, a prescription in your eyes. So taking a break from that is extremely important. If you feel that your eyes are gritty and dry, using lubricants, during your screen work, maybe once or twice in
Yeah.
the day is a good healthy habit. And just being outdoors, limit your indoor work. Now that's a very important thing that I tell parents
Yeah.
for children. Right now, 2 hours of outdoor play is so important for children. Now, myopia or getting glasses at a young age is an epidemic. Let's say it's a global, worldwide epidemic at present because of excessive exposure to screens for young kids, which we can't help. Let's just face it that parents are busy or
Yeah.
kids are exposed to screen. There's it's required out of them, right? Like
Yeah.
we are in the digital era, and then there's no way out of it. But limiting that to a minimum possible that's required from, let's say, school or whatever is minimum required, just limit their screen time or cut off the screen time. That's the best if possible. And increase their outdoor activity. At least 2 hours in the day, kids should play out.
I love that. One thing that I taught about, two things that you brought up in this topic, and I really want to spend a little bit more time on it, is because the tropical climate that we are in, never taught about the water, just because you're innocently taking your kids just to play in the water. And I have been around so many kids that constantly dip their head in the water over and over to the point that they come out of the water, their eyes are extremely red. They didn't know how harmful that can actually be. And the next one, it just came to me when you were talking about different things that you should be aware of, like your screens, never taught about that, is the one that everybody laughs about. If you're stuck somewhere, like for me, I love music, so sometimes we go into a music studio and we're working with a new artist, right? And that studio tends to be limitless to windows. There's no windows. So it's pretty much, it's no light, like what we're seeing right now. Soon as we get outside, we find it so fascinating how our eyes has to adjust to the new light. That must be harmful if we're constantly doing that.
Absolutely. I think a few more tips, if that's what you're heading at.
Yeah.
When you're on the screen, there are a few more things that you can do to avoid the harmful rays in the eyes, is to make sure that the illumination of, your screen illumination and your background illumination match.
Yeah.
So let's say in a dark room, don't sit with your laptop, which has bright light glaring into the eye. Conversely, don't be in a very, very well-lit room with a dull screen, right? So in both these situations, the eye has to adjust, and then you're in the bargain harming the eye.
Yeah.
Then also the distance from the screen is important. So if you have a laptop in front of you, make sure that you have at least 1 arm distance. If you have a big screen like a PC, make sure you have 2 arms distance from where you sit. Okay. And even the level of the computer is important. It should be at the level of your eye.
Okay.
So make sure that it's, you don't really have to hunch, or you don't really have to constantly bend your neck up to look at the screens. Ergonomics is again a very important occupational hazard with office desk jobs. Now, with our sedentary lifestyle, our posture is extremely important. So, having comfortable chairs, keeping the screen at the right level is important. So these are a few things. And then there is also an anti-glare coating that you can have on your screen to just cut out the harmful rays coming into the eyes.
Yeah, man. Like I said, we were going to get some knowledge here, and we are. So thank you so much. We're going to take a next quick commercial break. When we come back, we're going to be wrapping things up and obviously asking any questions that you may have. So once again, you can go ahead and send us a message to our Instagram or Facebook, of course, at 103.1 FM. It's just search Bobo Cayman, and you'll find it easy. We'll be right back.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
All right, welcome to the show. It is Bobo 103.1 FM. Thank you so much for tuning in. And don't forget, like I said, I know a lot of medical students. There's a lot of individuals that are very much in love with this show. And we just want to thank you. Without you guys, this show would not be possible. HSA is a big sponsor of the show, so it's all things HSA. We talk about everything, specialties, events. Maybe there's a different department that's now popping up at HSA that you should know about. We want to make sure that you are always in the know. Good Doctor is here. We're going to have her introduce herself again for the new listening public. I know that this is something that's repetitive for her, but she's gotten used to it so far.
Okay.
So, yeah, just your name and your job that you do at HSA.
I'm having a great time with you, Dean. I'll say my name over and over again
Thank
if required.
Thank you, man.
Well, okay, but I'm Dr. Sahebaan Sethi. I'm a UK board certified ophthalmologist with HSA, working to close to about a year with HSA now.
Amazing. Now, we've always heard doctors are always telling us what to consume, what to eat, to take care of our health. But what about our eyesight? Like, how does her diet feeds our eyes? I would like to say, like, what food should we be containing to make sure that these are staying at 2020 and without disease?
Well, a healthy lifestyle and a balanced diet is a must for healthy, your overall health, and eyes are no different. So you have to be careful about what you intake. But particularly about the eyes, I wouldn't say, it's not a direct correlation like you would say smoking to lung cancer or COPD, right? So there's no direct correlation. But still, maintaining a healthy diet can benefit your eyes and prevent you from having certain conditions, which can arise from deficiencies. So, anything which is rich in antioxidants are good for the eyes, right? Now, antioxidants will help you prevent a condition called age-related macular degeneration, which is just an unexplained age-related deterioration of vision, okay? And although there is no direct impact or benefit of having antioxidants, but studies have mentioned, research has mentioned that antioxidants can prevent or delay its development in the eyes. Then same goes for omega-3 fatty acids. Now those are good for patients who have dry eyes.
Okay.
Then there are vitamins like vitamin A, vitamin C and E, and minerals like zinc. So all of these conditions are also protective for the eye. So, if you want to really translate into what exactly do you eat, green leafy vegetables, a lot of colored vegetables and fruits, berries, like, let's say your pumpkins or carrots and any of these colored vegetables are extremely good for the eyes. You can even have fish oils, fish, eggs, legumes, nuts, berries, all these are good. Over and above that, I think it's extremely important to keep yourself hydrated.
Yeah.
And not forgetting that even rise in diabetes and hypertension can affect your eyes. So, your diets which are keeping these two conditions under control. So, if you're a hypertensive, consume less of salt. If you're a diabetic, consume less of sugar and keep your sugar under control. So, these things are also extremely important indirectly to make sure that your eyes are not suffering.
Yeah, my mom used to. Obviously, she knew I had dreams of becoming a pilot. So, in order for me to eat my veggies, she'd say, "Hey, that's gonna give you a good eyesight." And especially the pumpkin, I always leave the pumpkin on the side
Well,
when
moms
I
are
was
our
eating soup.
first doctors, aren't
They
they?
are. They
Yeah.
are. They take it far sometimes. They do take it far sometimes, but they
Well,
are.
I'm with the moms. I'm one myself. So
Yes.
sorry, can't be with you.
So you
there.
do the same thing also?
Of course.
That's
Yeah,
amazing.
yeah.
That's good. I do it with my kids now, but I
See, life
remember
comes a full circle.
it does. It does, because I do also say that. Like, in order for them to eat something, I say, well, you know what? It helps with this,
Yeah.
especially because there's one that's very much active on the basketball court. Really good. Matter of fact, he got a
lovely.
scholarship to play at a very good school in the United States, and we were
Amazing.
always on him about, like, you got to eat this, you got to eat that,
your
or else you won't
proteins.
perform.
Yeah.
Yeah, so eyesight just as important. Now we're on the topic of kids. You see how we brought that in a great segue. Glaucoma now. Can that affect kids?
Sorry, say that again.
Is it glaucoma? I'm saying it right?
Glaucoma in
Yeah.
kids? Yes, of course. Now,
So kids can get it.
Let's remember that glaucoma is a condition that can affect an individual of any age at
Okay.
any stage, right? Now, even children who are born can sometimes be born with glaucoma. Although it's really rare, we call it congenital glaucoma when children are born with glaucoma. Now,
Yeah.
these set of glaucomas are rare, but at the same time extremely evident. So, you'll see babies with enlarged eyeballs. So they have really huge eyeballs, which are blue in color, and they will be extremely photophobic, extremely intolerant to sunlight. You will see that they're tearing a lot. So, these are some signs to pick up that the kid has glaucoma and should get medical attention immediately.
Yeah.
But even beyond that, even up till the age of 18, a child can develop glaucoma at any point, which is what we label it as juvenile glaucoma, and then adults, of course. So that's why it brings me back to the point that, every preschooler should begin his eye examination at that point, at 4 years of age, if everything is fine, if the baby is not a premature baby, and must go through his entire childhood up until the age of 18 with annual checkups.
Okay. And just want to talk about this again, because this is very important. We're coming almost to the end towards our interview. I think one of the questions I want to ask is just proper eye care. There's things that we can recap again for those that are listening to us for the first time. Just how should we take care of our eyes? Like little tips that you can give.
Okay. Now that we're talking about kids, let's also begin with how to take care of
Absolutely.
eyes for kids. Now this is mostly for parents.
Yeah.
Now a few signs to look out for. Let's also understand that kids are probably not able to explain themselves that well, so you may not really get to hear from them what's going on. So these are signs that the parents most likely pick up.
Yeah.
Right? So you have to know what to watch out for. So if you see that your kid is going really close to the television or holding books very close to his eyes, now that could
Even
be
books?
a sign. Absolutely.
Oh, wow.
Absolutely. Now a lot of the times the intention of the parent is to scold the child, saying don't go close to the TV, your
Yeah.
eyes may get harmed. but it's actually the other way around. It's because the eyes are compromised that he's having to go close to the TV to be able to watch it clearly, right? So now that is a typical example right there for a child who needs glasses. So don't scold them, bring them to the
or ask them.
Yeah,
Are you
ask
having
them.
trouble seeing it on the sofa?
Exactly. Sometimes teachers are able to point it out that a kid sitting at the back row maybe was not able to, doesn't perform very well in school. It could just be indirectly like that. So it's not necessary that your child is naughty or not interested in studies, but he's just not able to tell you that he's not able to see the blackboard or what's happening ahead of him.
And parents, please pay attention to this. My testimony is around that because my son was doing really poorly in classes one year, really bad.
Okay.
And we didn't know what happened. We thought that something happened, like he was being bullied or something was taking place at school. And when we asked the question, going back to what you said, instead of being, being a parent and feeling like we have to discipline and why are you not doing good and you need to bring in A's and B's, we started to ask the question, and then we found out that he was embarrassed. He was having trouble seeing the board, and he's wearing glasses. He's super good now in class, but it's because we decided to ask the question. So that was so good that you touched on. Sorry, you can continue.
Absolutely, and that's why I think if a preschooler gets a regular eye exam, even without him having told anyone, we are able to pick up that he has an eye number and he needs glasses. So then, we cure the problem before it actually, impairs his quality of life or his performance in school. So, so parents need to watch out for this.
Yeah.
I think over and above keeping things very close to themselves, also squinting. Now, if you see that the child is really squinting or squeezing his eyes to be able to see clearly at something which is far away, if the child is rubbing his eyes excessively, if the child is tearing excessively, sometimes actually it's quite common, the drainage of the tears into the nose. Now, every time we cry, our nose waters, right? That's because there's a drain that connects the eye to the nose. And in newborn children, it's quite common that duct is blocked. And you feel that, your child is excessively tearing even when he's not crying. So that's again something that needs to be brought to a doctor's attention. Any headaches, if your child complains of headaches, it's not common for children to have headaches. So if they complain of headaches, that's again a red flag.
Yeah.
Now for adults, how to take care of the eyes, I think if you are on the screen a lot, remember the 20-20-20 rule. I'm going to go over it once again. It's extremely important. Every 20 minutes of your screen time, take a break for 20 seconds and look at something 20 feet away, which would be look out of your window, maybe to a tree far away, right? Use lubricating eye drops if you feel that, you're in an enclosed office space with air condition. It's a very dry environment. And over and above that, you're also exposed to screens.
Yeah.
So look after your eyes there. Every time you're getting into the pool or into the ocean, make sure that you have protective goggles on, especially for children, because, they can catch all sorts of infection and allergies from, this water, which is shared by all of us. So it's not exactly sterile.
Yeah.
So, these are some things, and just a healthy lifestyle, a balanced diet, and regular checkups is a must.